join those as well. So if you are joining us tonight, if you could please do me a favor and double check that you're muted. We'll have a time for questions at the end, and we prefer that you put those in the chat if you have a question as we go, because we have a lot of great information for you today. So if you could add those to the chat, we'll get to as many questions as we can at the end of this presentation. But we do want to get started and talk to you about the health science pathway that we offer here in District 214, and welcome you to College and Career Ready Night. This is a vibrant pathway in our district. My name is Dawn Francis. I'm the Math Science Division Head here at Hersey High School. So I'm pretty familiar with the pathway. We have a large number of students that are involved at Hersey, but all across the district. It's usually one of the top 2 pathways that our students select in each school. Business is a close second, tends to be, but this is one of the, I would argue, the best ones, but it's the one I have the most interaction with. So we have an esteemed panel with us here today who are going to be able to speak with you, and I'm going to have them introduce themselves. Well, how about this, folks? Do you want me to go through? I'm going to go through the slides of the pathway first. How does that sound? And then I'm going to have you all introduce yourselves. And so then I don't have to bounce back and forth with some of that more standard information. And for those of you that are just joining us now, please make sure that you mute yourself so we don't have any silly interruptions. All right, thanks. So we'll get to these interactions in just a second, but my initial job here is just kind of let you know what goes on in this pathway and where you can find this information. So if you go to the District 214 website, it's pretty easy to find. If you just Google District 214 or D214, you're going to come across this. And you're going to look for something called the academic pathways. So you can find this under career pathways, but you can also find it under our academic handbook. Because at District 214, these things go hand in hand and they're tied together completely, because we design programs for students to be best prepared for the pathway of their choice as they graduate. Certainly, there are going to be students who start in a pathway and change their mind, and that's what this is all about. But we do want students to get some familiarity with different pathways. And then if they want to continue to pursue them all 4 years, that's excellent. And we have classes for you at every single year. But certainly if you change your mind, you might go from like the law pathway and then decide you want to be in the healthcare pathway. And that's an option for you still. It's not like you choose it once and then you can never get into it or you can never change. So something for our incoming families to be aware of, and our 8th graders who are maybe on this call. It's not like you're choosing a path when you must stay in it for the rest of time. So maybe you're interested right now in criminal justice, but you may then be able to change into the healthcare pathway. And some students pick 2, and that's okay also. So just know that there's that flexibility for you. So in this pathway, the one that we're most concerned with this evening, we're going to talk about the classes that we offer that are in addition to your core courses, right? So we do recommend that you take a strong background in all your core areas to get into as many post-secondary programs as you can, because some of them care, if you're going to a very competitive program, you're going to want to take, your 4 years of science and take all those AP classes you can. But we're talking today not about those classes. We're talking about our healthcare pathway. So we offer, the first class is called Introduction to Healthcare 1. At some schools, that's tied to an exercise physiology class. It's not tied at every school. So that's just something that you'll have to look into your school with your specific counselor, and they can talk to you about that. And then we have Healthcare 2/Med Terminology, 2nd year. That would be sophomore year. Now, again, if you jump in later, you can also double up. Some kids take 2 at a time, and that's also fine. And then your junior year, we have college nursing. So we call that the CNA program. So if you hear us say CNA tonight, that means college nursing assistant training. And you will leave after you finish this certified to be a CNA and make sometimes a lot of money. I'll let the students and the teachers talk about that a little further. But you can also take college human anatomy and phys and honors physics. If you wanted to do that pathway, you can tie those together. You probably want to take honors physics with those. And then also, there's this middle college health careers program. And some of the schools will encourage you to take like AP biology as a senior, or you can even do Med Academy. And I'll have Ms. Brosnan talk about that in a moment. So this is our, sorry, I'm trying to scoot some things around. This is our pre-med pathway. So if you take a look at that, you'll see similar courses. And that's where those AP classes are listed. So it doesn't look a whole lot different, but you can just kind of see what that pathway is. And if you really want to dig into the career-related activities on that right-hand side, you can dig into that on your own later. And then this is where you find that lovely stuff that I was mentioning earlier. So if you go to our District 214 website, it's www.d214.org. You can click that bottom column, And there you're going to find, I'm just letting a few people in the waiting room. Sorry, folks. And there you're going to find that academic programs and pathways guidebook. It's quite long, so there's a lot of pages, but you can search bar at the top and you can find exactly what you're looking for. But you'll also get to see all the other career pathways that we have to offer here in District 214. So having said that, I'm going to scoot back to our initial slide and let you all get to meet our panelists. And we're going to introduce ourselves in the order that is on the screen. So I've already introduced myself. So Teresa, it's your turn. I think it's Therese, right? Sorry. Go ahead. Oh, you're muted, my dear. There you go.
Good. Okay.
Yes.
My name is Therese Coughlin. I'm a registered nurse. I've been working as a nurse for about 8 years now. Um, and I currently work in a cardiology clinic working with electrophysiology or the electrical pathways of the heart um, at St. Mary's Hospital.
Thanks.
Mhm.
My name's Scott Smoron. I'm an orthodontist in Mount Prospect, and I've been doing this for about 26 years. So I'm a specialist within dentistry. And yeah, like I said, been here about 26 years. Um, and I think that's all you want for initial intro, right?
Yes, I'll get to your
Cool.
specifics in just a second.
Sure.
Miss Blank, are you on this call? I thought I saw you hop on. Don't see her now. Karen, do you want to go ahead? Oh, sorry, Beth, how about you go ahead?
Hi, sorry guys. It was not allowing me to unmute. I'm good now.
Oh, good.
Hi, Karen Blank. I work at Elk Grove High School teaching the Introduction to Health Careers 1 and medical terminology. So year 2 of the program.
Thank you. Beth, you ready? You're muted too, sorry. Hey, panelists, can you all unmute for just a quick second? I don't know what's going on with the setting. I don't think anyone's muting you, but you are all ending up muted.
There we
Thank
go.
I was able to
Go ahead.
unmute.
There we go. Thanks, guys.
Have to do it on your face. So my name
Oh.
is Beth Brosnan. I'm a nurse. I teach at Rolling Meadows High School. I teach year 2, which is the medical terminology. I also teach year 3 or 4, which is the certified nursing assistant program. And I teach year 4, which is a district-wide program known as medical terminology. I'll talk more about that later.
My name is Tim Meyer. I am a science teacher at Wheeling High School. Just like Karen had mentioned, I teach Intro to Healthcare Field 1, which is the first year of the program, and then second year Intro to Healthcare Field 2, followed by Medical Terminology. As far as the healthcare field, I'm a certified athletic trainer by trade, so I'm also one of the certified athletic trainers at Wheeling High School.
Hello, my name's Brent Vilches. I'm also a registered nurse. I teach at Hersey and at Wheeling. I teach the intro class, Intro to Healthcare Field 1, and then also the certified nursing assistant class at both schools.
Hello, my name is Dominica. I'm from Buffalo Grove High School and am a senior now.
All right, thanks, Dominica. All right, so what we're going to do is we have a series of questions, and we're just going to ask the panelists, what their background is, what they, have done to get to their current positions they are in, and what they can kind of advice they can give you all. So if you have questions as they come up, maybe just add those to the chat, or you can keep them write them down to the side so we can get to them later. But we're going to start off with Dr. Smoron. Why don't we start with you? Can you talk to us about 2 things for us? Can you give us what training did you have? And let's start with that. What training did you have? And maybe give me your undergraduate with that. And then can you talk to me about a normal day in your life, how that goes?
Sure. So my undergraduate education may not be your typical healthcare sort of one. I actually basically focused on chemistry and mathematics, and then also picked up philosophy as another major. So I kind of an odd mix. And somebody early when I was in high school told me, study what you enjoy studying. because going on to become a doctor is a long educational process. And if you're not enjoying what you're studying, you're not going to have fun. And so I wound up going off to dental school with a little bit of an atypical background with the chemistry and the mathematics. And so I basically focused on the things that I really enjoyed doing. And then you also have to throw in the basic side requirements like some biology classes and stuff like that. So you have the requisites that they want you to have at a minimum to apply to school. While I was going through high school and college, I worked in a couple of different dental offices. My father was an orthodontist too, and so I also worked for him. So it's one of those typical things that if somebody at the high school age is interested in our field, you can really almost reach out to most dentists and they'll link you up with somebody to say, come on in, spend a day. We can always use somebody who could work on the side on things and such. We've got things like lab work, sterilization. And so I started actually working in offices as a teenager, and that gives you some very real world experience of, is this what you want to do or not? You can figure it out pretty fast if you're going to enjoy it or not.
All right, great. Teresa, would you mind answering similar questions for me? What's your background? What's your undergrad in? And what's a typical day like for you? And you may be muted again.
Sorry. Okay, there we go. I ended up going to a 4-year bachelor's degree program. That isn't the only option. You can do a 2-year associate's. But I ended up doing the 4-year bachelor's. And then after that, took my NCLEX and became a nurse. That was my certification to get my RN. Let's see. I've worked numerous different jobs within nursing. I actually did start out as a CNA, or sometimes it's called a PCT or a patient care technician. And then I've worked medical surgical, which is, kind of like your typical adult patients, kind of across the board, different, medical, complex medical systems. So that I went to ER after that. I've worked same day surgery, and now I work in a cardiology clinic.
All right, great. So let's ask a couple more questions to you all, just curious for this. So Dr. Smore, back to you for a quick second. What is your best advice to our students who are on this call today about if they're interested in your field or another healthcare field, like in 2024, what's the best advice that you can give them?
Well, I was kind of saying before too, is that if you're interested, almost every practicing dentist is usually more than open to mentoring students. I have, through your guys' programs, I have that. I sometimes have people who call me up who are in college and thinking about it. And so like really over the course of this year, I've probably had at least, I'm going to say 7 or 8 different kids between teenager and college years who've just come in and spent some time seeing what we do and learning and actually seeing us in action doing it. Most of us are here 5 days a week. We're around your neighborhood and such. And if someone were to call me up and say, I'm really interested in something like oral surgery, which is a different specialty, I can always point you towards the person who would be willing to kind of have you come in and see that. I was mentioning before about the education and finding, to keep going up through the process, you have to get good enough grades and study something that you enjoy. For me, we didn't hit this earlier, but I have my 4-year undergraduate. Dental school's 4 more years past that, and then to specialize into being an orthodontist is another 3 years past that. So if you're going to do 11 years of college, you better kind of enjoy school to some degree, although that's also kind of like a sort of thing of school is always kind of difficult no matter what level you're at as far as it goes. So enjoyability is more livability probably. But I would say reach out to anybody that you know. Try to focus on, enjoying the work or finding something that you enjoy studying. And trust me, everybody's out there more than willing to help the next generation find their career path. We're all kind of like helpers out here.
Thanks for adding that back. I appreciate that. Therese, how about you? What advice would you give to students who are interested in being a nurse?
Yeah.
Oops, sorry, we're muting some folks.
So what I would do is maybe while in high school, look into volunteering at the hospital, even just I think you can transport patients or deliver newspaper, things like that. Just get kind of an idea of how a hospital works. You can talk to the nurses, doctors. Usually, almost everybody will be willing to, kind of let you know what things are like. For nurses, there's many different types of nursing you can do. It's one of the most versatile careers. Opens a lot of opportunities for you. You can work 10-hour shifts, 12-hour shifts, 8-hour shifts. If you work 12-hour shifts, it's only 3 days a week typically, which is kind of nice. I mean, that gives you a lot of flexibility within your week. Yeah, so I would volunteer once you are able to do CNA or PCT. That's going to give you really hands-on experience to let you know, is this something that I'm actually interested in, or is this not? Because it can be a very messy job. It can be very rewarding, very interesting. You learn so much. So that would be my advice. Talk to nurses, doctors, CNAs, find out what they love about their job, find out what they don't love about their job, and see if, maybe that's something that you could work with or not. Just getting familiar with the hospital and how things kind of work. That would be my advice.
All right. Thank you guys both so much. And so there'll be some question time at the end, but we do want to shift gears a little bit to our District 214 teachers so that we can hear a little bit about what the programming looks like for our students who come in freshman year, sophomore year, junior year. So first question, I think we can kind of go around. Teachers, you guys can focus on the different courses that you all know each other and your specialties. But if you can describe for us the course that you teach as part of the pathway, and maybe let's start with Brent, can we start with you, Mr. Vilches, just because you are teaching the intro class right now? And Ms. Blank, maybe you can, I know you do more med term, right? Mr. Meyer, you can also hop in on this one, but can you talk to us about the first year course at your school? And then what content and skills are students exposed to? And what other types of experiences do you all draw on at your particular location? I know we have different things like Scrubs Club and different other healthcare clubs that our schools that our students can get involved with right off the top. So Brent, do you want to start and then we can kind of pass it around a little bit?
Yeah. So the first year is really about exposure to the different careers in healthcare. There's just so many different ones. It's not just, nurse and doctor. So the first kind of month or so, we're teaching the students about all the different options that there are in the healthcare field. And then we're diving into the medical terminologies that they will see throughout their career. It's a totally different language. Sometimes I throw in words accidentally with friends and they're like, what are you saying? And you kind of just forget that there's just a totally different language that you need to understand in order to do the job successfully. So we really make sure that the students learn that and are proficient in that. Outside of just the classroom, there are opportunities at different schools. I know Hersey does a Scrubs Club, which gives the opportunity for students to actually listen to speakers from different parts of the healthcare field. So we had a podiatrist on Monday. Students are like, what does that do? And I'm like, just wait till Monday and they'll explain and they answer questions. We've had plastic surgeons, we've had neurologists, we've had, child life specialists. I'm even learning stuff. And it's really interesting for them to ask questions to those people themselves. And that's part of the class too, and making sure that students are going to that and getting the full exposure, so that they know, if they want to continue on and all that. So it's really about really exposure and kind of just getting them used to the language and kind of just the basics of the healthcare field.
Tim, did you have anything you want to add?
I would say Mr. Vilches did just a great job right now of explaining it. That's kind of how it is at Wheeling too. spend a lot of time learning about medical terminology and body system, basic anatomy and physiology. Also exposure to different careers in the medical field. We have speakers also that come in. We take field trips. There's a field trip to Harper College that we usually go to see all of their facilities and all of the different programs. We have a cadaver field trip that we go on every year to see a cadaver. So again, we're using the 2 years of Intro to Healthcare 1 and Intro to Healthcare 2. We're using those years to learn medical terminology, learn how the terms are broken down and constructed, and then at the end of that second year is when we possibly get some career or not career, but college coursework, college coursework from Harper, right? If they pass that proficiency exam. So that's kind of what we're doing for 2 years.
All right. Karen, did you have anything you wanted to add, maybe about some of the different experiences that students have in MedTerm that are
Yeah.
like, unexpected or different?
Well, let me just start by saying Tim was the initial teacher in this program. So we give a lot of credit back to Tim Meyer, who started, I think 13 years ago. My son's about to turn 13. I'm pretty sure when I came back from maternity leave, we were getting this going. So, back in the day, it was 2 different courses at Harper, and there was a marriage of 2 courses, really. It's that Intro to Health Careers and Medical Terminology. So between the 2 years, you guys will learn about communication and teamwork, employability, which we're just going through right now in MedTerm. Great unit. I'm going to circle back to that one, but really a focus on the medical terms, both in classroom setting, but like clinical settings. We look at case studies, we watch different videos, and obviously we have speakers coming in to our classrooms. So I think, between the 2 years, I have anywhere from 15 to 20 speakers coming into the class. So lots of, to use the word that Brent did, a lot of exposure to different careers. Reading, math, all the different core classes. So we're getting, these students ready for, I think, ACT and SAT prep with case studies and reading and, applying different math skills. To go back, I think the unique thing in medical terminology that we just got done with was the employability unit. We created resumes and cover letters, and we just went on mock interviews. Each school does it a little bit differently. At Elk Grove, I use my admin and my teacher colleagues and a parent who's in HR and healthcare to come into the class. And so over the course of 2 days, I get block A, block B done, and students dress in their business attire, and they go through these interviews, and it really prepares them for this next step, which could be internships, it could be apprenticeships, or it could be their first jobs. Our career pathway, I just can't say enough about. You could work as a senior in high school, as a CNA, as a professional. If you start this career pathway as a freshman, you go into the second year medical terminology as a sophomore, you can take junior year CNA courses, and then senior year, it's open. You can start working as soon as you turn 18, and maybe a few companies when you're 17, but we're getting you ready in that MedTerm class. So I think the mock interviews, employability is a really special part of that class.
I will double down on that. I had a student last year come up to me and told me he got a job at AutoZone because his practice interview in MedTerm was so effective. He knew exactly what to do. And so even though it doesn't seem like it's connected, he was really proud of that. And he's actually he lets me talk about that with other students who are doing it because he said it's so real and it was so helpful to him. So really, really excellent, almost like bonus sidebar of this program is that students are getting these real world experiences, practicing for interviews where they're just like a smaller job that they might get. One girl was going to have a barista interview that weekend, right after we did our interview. And she was super grateful for the experience. So it's a wonderful little extra caveat to the program. Let's turn to CNA. Brent, do you think Brent and Beth, you guys can hop in maybe on this one? Beth, do you want to talk first about CNA, or just tell us what's that 3rd-year course all about? What does it entail? And maybe you guys can hand off talking about clinicals.
Yeah, so I can start by talking about it's a dual credit class. And for what that means is you're getting the same credit for college as if you took the class at Harper. So it's a year-long class where we teach you all of the nursing assistant skills or patient care skills, blood pressures, how to lift people without getting hurt, how to turn them, how to use the medical terminology that you learned the year before to take care of people. I myself was a CNA like Teresa was, but my training was only 2 weeks at the hospital where I was employed. It was not enough. So we take the time to really teach the students. And like the dentist, the orthodontist was saying, I tell my students, if you want to be orthodontist, can you brush somebody else's teeth? If you think you want to be a nurse, can you lift somebody? What about physical therapy, ultrasound tech, radiology tech, respiratory therapy? There's pretty much a shortage in every aspect of healthcare. And some of the students, we've probably had 15 to 20 students end up working at nursing homes and probably another 10 or 15 working at hospitals. The hospitals are so short staffed that they will hire teenagers, which is fabulous. And I've been doing this for 5 years, and I'm hearing from students that are applying to PA school, which is a physician's assistant. I'm hearing from nursing students that want to be nurse anesthesiologists or nurse practitioners. So what we want students to realize is you're using this as a stepping stone to build, you can get a job with benefits and then keep going to school. So I'll let Brent talk about the clinical that we do.
So part of the class is the clinical portion, which means the students get to go to local nursing homes mostly and get the hands-on experience that they need to get the certification. So basically what they do is practice the skills that they learn in the classroom, which, by the way, the classrooms are amazing. There's beds, there's IV poles, I mean, it's a whole setup. I was just looking at pictures of a whole setup that I did the other day. But we practice in the classroom, and then we go into the nursing homes and actually apply them to people. They walk into a patient's room and, they do a bed bath, they give them their food, they just do what a nursing assistant would do. And that really helps them get the experience and make sure that they know it. But also it's just good for communication skills get enhanced, personability. Even if they decide that they don't want to work as a CNA after the course, getting the certification looks great on resumes. You can't take away that experience that a high schooler gets, getting 40 hours of hands-on experience. And so it's really beneficial. And speaking of the students that are able to work as a senior, I have one that during the first week of school, she's doing an apprenticeship, and she came up to me and she's like, I'm working on a COVID floor at Northwest Community, and just like sharing all these stories, almost like a colleague. And I'm like, you were taking this class last year and now you've just like learned so much and you're already so far ahead of so many others. It's just a really good opportunity.
Yeah,
Becky,
every
you wanna talk-
year we
Go ahead,
have
Tim, sorry.
students who work as CNAs their senior year of high school. And every year I have students asking, well, I want to go to medical school. I want to go to dental school. I want to be a veterinarian. Why should I become a CNA, right? And we talk about patient care as the common denominator for most careers, most practitioners that work in the medical field. And so a lot of the pre-professional programs or professional programs, med school, PA school, nursing school, sometimes they require at least volunteer time in the medical field prior to gaining entrance as part of the application process. And so, not only are you're not volunteering, you're actually working as a practitioner in the medical field if you're working as a CNA. And so many of our students who are moving on and using the CNA as a stepping stone are finding that it's an amazing thing to have on their resume.
Could I jump in? Sorry, Dawn, if you're going to move
Oh,
on.
go ahead.
Okay, one last thought. We've heard from nurses, we're talking about CNA, and I think I think we've tried to get away from this stereotype of it's a nursing program, but I still feel like, I don't know if it's stereotypes the right word or stigma. We still have lots of ladies in the program, lots of females, but this is a health careers pathway, like healthcare pathway. So it is open. Obviously Tim with being athletic trainers, great, is a good role model. But I look at my former students that come back to speak to me. One is a nurse, but I have a social worker, I have an athletic trainer, I have a dietitian, and I have a also a nurse, sorry, but in public health. So not your typical job. And I just want to express to people that are here that it is great. There is a nursing program. The CNA is a nursing experience, but it's bigger than that. It's about the experience in healthcare. That's the most important thing. So please, please, please don't think that because you go into the CNA that the next step is nursing. Tim just said it's all the field. So big emphasis there.
Oh yeah, we have students, former students who are now medical doctors. We have physicians, we have PTs, we have dentists, and of course, in addition to nursing, but it's definitely not, we do not focus on nursing. It is any career in the medical field.
Okay, so on that note, Beth, do you want to talk to us a little bit about what Medical Academy is and what that capstone course can be for some students?
Yeah, so year 4, there's a class that students could take from all over the district. It's a small number of students that are looking to get an anatomy and physiology college class done at Harper while they're still in high school. So these are students that maybe have looked ahead and thinking, I want to go to med school, I want to get into physical therapy school or occupational therapy, and I want to take this course while I have a little bit of backup support. It's a very challenging course. The most interesting thing I think about it is it's a cadaver. So the students get to dissect a human body, which is a pretty unique experience for high schoolers to actually learn about all of the parts of the body. During the second semester, the district helps the students find an internship that they do after their physiology class. And I've been doing this for 4 years. I just reached out to a couple students. I have one that got accepted to a bachelor's medical school 8-year guaranteed acceptance program. Another one is looking to get into physical therapy. Another one wants to be a nurse anesthetist. So it's a really interesting opportunity if you're really sure you want to do something in the medical field and you want to take this class that is often required in college and you have enough room in your schedule. The students take the class at Harper, and then I meet them at Forest View, which is one of the satellite schools, to do some other hands-on experience. So maybe if they didn't take a CNA course, I want everyone to know how to take a blood pressure. We practice blood sugars. We do blood typing, trying to just give them the experience of what it would be like to take care of other people.
Right, perfect. Hi, Dominica, how about you? Let us know a little bit about your personal experience. So Dominica is our student from Buffalo Grove. Can you let us know a little bit about what your experience has been like, what classes you've taken, and what has been like maybe your favorite part, or what advice you would have for other students?
All right, so as I say, I'm a high school student now at Buffalo Grove, and I was an intern in a nursing home at Warren Bar at Buffalo Grove, and I learned a lot of new things that healthcare workers do in different areas, such as physicians, nurses, chiropractics, and a lot of CNA stuff. It was a great place to learn about this because these things I'm gonna see like on my future because I really want the healthcare pathway. And the courses I've been taking are biology, chemistry, healthcare, exercise physiology. Now I'm taking AP biology, and CNA is a really good course. And I gotta say that CNA and AP biology are the most helpful courses that you can take if you want to like major in a healthcare pathway. All of them give a lot of new words, and then new understanding of how that works. And of course, you will use this on your college that you go.
Thank you. All right, so we do have some questions coming in for our panelists. So panelists, I'm going to try to figure out who the best people are to answer these, but if I pick the wrong person and you have something to add, would you please let me know? One of the weird questions that just popped up randomly is, what's the star for next to physical education on the list on the slide that I'm showing? I'm not entirely sure what that's for. I don't think your PE classes are usually a 0.25 credit, so my guess is it has something to do with the numbers, but I don't know what that red star is for, but I'm going to ask my bosses and find out for you, and I can email you, Leilani. All right, so we have a question from Chris Jones, and he says, I see there's both a health sciences pathway and a science, engineering, and math pathway. So that's listed sometimes as a STEM pathway for our students. It says, for someone who's interested in biology and biochemistry, but doesn't know yet whether they want to pursue a doctor or nurse career or a scientific or medical research career, can we talk a little bit about the overlap between the pathways and where they differ? And are there opportunities to pick and choose courses for either one? I can talk to the STEM pathway because I'm a math science division head. So I'll tell you right now, we have a lot of students who do the STEM pathway. Some students take engineering courses. They take some Project Lead the Way courses, but I've had students who major in STEM or biostatistics or a lot of different fields and research, and they do a straight content pathway. So they do more of our biology, chemistry, physics, AP environmental, depending on the field they're interested, AP physics C, AP chemistry. So those are all options for you. A lot of the students who aren't sure do certainly take the intro to healthcare courses as well, just to kind of see, because sometimes that helps them decide what they are truly interested in. Or sometimes like, ooh, whoa, this is not for me. And that's great. Like, we would love you to figure that out younger. We don't want you to like go off to medical school and be like, now's the time. So it's helpful there. So teachers, have you had any experiences with students who have maybe flipped between those two?
Yeah, I have a student that did some of the STEM classes, and he also did the health careers pathway, and his goal is to work in biomedical engineering. So this is somebody that uses their engineering background and their medical interest. Maybe they're making prosthetic limbs or those bionic legs that you see people with. Maybe they're making pacemakers or diabetic pumps. I also had a student that did the parallel. She was doing the education program where they did student teaching and CNA at the same time in the healthcare pathway because she couldn't decide between the two. So we encourage you to explore because all of them are going to give you the hands-on experience. So just know that there's more than one way you can jump between the pathways if you need.
And you can pick two. I said that earlier. I don't know if everyone was on that, but you can pick two with your counselor when you pick those, and that's okay. And you can kind of oscillate between the two. We have a question specific to Therese. Therese, are you there? Can you speak to being a nurse at a hospital versus versus a client versus a doctor's office? So maybe can you speak to that experience, the hospital piece versus the office piece?
Sure. Yeah. So I don't have experience in a nursing home, so I wouldn't really be able to speak to that. But I've worked in a couple different units in hospital settings. I did start out as a PCT and then did med surg and emergency room. And basically, yeah, for the most part, I work 12-hour shifts, 3 days a week. You have some control over your schedule, which is pretty nice. Majority of your day, when you initially clock in, you get report on your patients, kind of plan out the day. You start passing medications, you do your assessments on your patients, you help out your teammates, because, the shifts can get busy, they can get you can get bogged down. So you really rely on your teammates, and you also want to be a good teammate to your coworkers as well. And yeah, you learn so much in a hospital setting. There's always something new. There's always something different. My experience has been overwhelmingly positive with other nurses, with doctors, physical therapy, speech therapy, occupational therapy. Everybody's willing to kind of teach you their little part in the interprofessional, team. That's a big big thing in nursing school. They talk about the interprofessional team, how we all work together to kind of take care of the patients. You take care of their family as well, because you have to keep everybody updated and in the loop. And then as far as like clinic is a little bit different, or like a doctor's office is a little bit different. That will mostly be like 4 or 5 days a week, maybe managing less severe medical conditions or patient conditions. You might be, if you're in an office, you might be, taking blood pressure, talking with patients about their medications, talking about healthy lifestyles, things like that, kind of determining, we call it triage, like if this needs to be escalated to a higher level of care, like they need to go to an urgent care or maybe an emergency room. You might be kind of deciding that with the, nurse practitioner or the doctor. Those are typically, it can be demanding, but not as demanding as maybe like a shift in the ER or med surge. Typically they're 10-hour shifts or 8-hour shifts. So it's kind of just depends on what fits right for your life. Hospital setting, it would typically be day shift or night shift, 12-hour shifts, and then clinic would more likely be during the day or the PM shift, which would be kind of like afternoon into the evening. So I hope that answered.
I think it's a great answer. This one says, perhaps off topic, this is from Jeff C. I feel like we're on a podcast. I'm a healthcare technology professional. Clinical engineering is another field with an aging workforce. Does this pathway expose students to this? And this is a parent of an incoming student. Anybody want to handle that one?
So I think the question was, does it expose the students to an aging workforce, right?
Clinical engineering, like tech, the question comes from a technology professional in healthcare.
Yeah, well, I mean, the CNA is all about, right, treating elderly patients, right, geriatric patients.
I think he's
there
thinking like
isn't as much.
workforce is aging out. Like, are we going to help, or do we have kids to help out with that? Jeff C., I might be reaching out to you to ask exactly what you mean. If you want to hop on here and elaborate on your question, let me know, and you can do that right now. I'm going to have somebody else answer the next question because we do have to be off of this in 3 minutes because there's another session. We have a hard stop. One of the questions I think from Ms. Brosnan is, how will the medical academy work with the students' regular school schedule?
That's a really good question. So the students have to be free their last block of every day because, we have the block schedule in high school. So your classes meet every other day. So these are students that have enough space in their schedule to be free at the end of the day and get themselves to Harper. If they're not able to get to Harper, if they don't have transportation, the district does provide transportation for them. So and then they get transported back to their home school so they could take the buses that are at school to get them back home. So we really want to make sure that it's an equitable experience. It shouldn't just be for somebody that can borrow their dad's car or their mom's minivan. And the internship, they have to get there on their own. So sometimes we have students that don't have transportation, and we can try to set them up with an internship near their school. And we've also had students do internships with the athletic trainers at their home schools.
And those are great options. Students really like that. So we are like down to the last minute then. It says, are there any courses that specifically focus on the engineering side of the medical field? I think those are typically within our Project Lead the Way courses, which really falls more under our CTE classes. I think there's one of the Project Lead the Way courses deals a little bit with biomedical, but I would have to double check with our folks that are in charge of those courses. I haven't looked at that content in quite some time, so I'd have to double check with that. So with that, we want to give total respect to all of you to be involved in other career pathways. So we're about to end this presentation. We are so grateful to our panelists. So panelists, thank all of you tremendously for coming here tonight and for being a part of this. If you have any other questions, folks that are on with us, there's like over 50 people. There's been over 50 people the whole time. Please let us know, and we're happy to reach out and answer any of those we can for you so that you can make the best decisions in choosing your classes here in District 214. So thank you so much and have a great evening. Take care, everybody.